Welcome everyone to another great edition of our Life with Breath Expert Series. I'm your fearless leader, Ed Harold. Today, we're joined by an amazing human being who has so much wisdom and knowledge to share with you. You're going to get so much out of this. We have Dr. Kevin Boyd with us, so welcome him with an open heart and open mind and taking this information in regard to your health, wellness, performance, in regard to your life and every cell of your body. Hello again, friends. We have one of the all-time greats in our presence for the next space of time in our life. So let's get focused and centered so we can really tap in to Kev's message today. So if we could just take a minute or two and just unplug from the external world, take a few moments just to meditate in the inner landscape that is the foundation of who we are. So if we could just slow our breath down, release and relax your eyes back into the sockets. Drop the low jaw off the upper jaw a fraction of an inch and allow the top of the tongue to rest on the upper palate. And as you begin to slow down this process of inhale, gently move the skull left to right, up and down, and try to find the perfect spot where the skull can rest on top of the occipital ridge. And notice the perfection of this moment for yourself. If there's any tension in the shoulders, the chest, the upper back, see if you can release that with the next few breaths. And center your heart in the middle of your intellectual mind. I'm inviting you to breathe with your diaphragm, slowly, filling the lower lobes of the lungs first, and gently letting each breath rise to the collarbone. On the exhale, letting go and drawing the navel back to the spine. Allow the exhale to be longer than the inhale. And just for the next minute or so, when the inhale is complete, hold the breath in for a 2 count. And when the exhale is complete, hold the breath out for a 2 count. Sense more breathing channels opening up in the mind and body. And then maybe inhaling 5% more than you normally do, exhaling 5% longer than you normally do without straining, and just using that brief little 2 count to still and silence the mind's eye and ear. Beautiful work, everyone. You can begin to deepen your breath, let your eyes open, reconnect yourself to this space. And we have the amazing Dr. Kevin Boyd. He is a pediatric dentist in Chicago. He is an attending instructor in the pediatric dentistry residency program at Lurie Children's Hospital, where he serves as a dental consultant to the sleep medicine service. His clinical focus is centered on prevention of oral and systemic disease through promotion of healthy breathing and eating. His primary research interest is in the area of infant and early childhood feeding practices and how they impact the palatial facial development and nasio-respiratory competence and neurocognitive development. Welcome, Kev, to today's program.
Thank you. I'm honored to be here. 1995 you started this. 25 years
Yeah,
ago.
we've been around a while.
Yeah, that's pretty impressive. And you were a professional athlete, you said?
I was a professional marathon swimmer when I was a kid. I would go out in
Get
the
out.
water for hours.
Oh my gosh. Okay, well, I don't know. Where do you want to start, Ed? I wondered, tell me about your audience mainly. What is the walks of life that most people who tune into your uh, platform, like, where do they come from? Age range, stuff like that?
Yeah, what I think we want to focus on today is bringing parents to the stage of maybe a new level of awareness of what pediatric dentistry, where it's been, where it is now, the potential of where it can go in regard to optimizing our child's neural activity, optimizing the body. Now, I understand you also went back to school for anthropology.
Well, I'm still there. Rodney Dangerfield, back to school. In my mid-50s, I started taking undergraduate courses in evolutionary biology and anthropology at Northeastern Illinois University, and I got halfway to a bachelor's degree. I didn't get any of this. Obviously, neither did any of you usually. In medical or dental school, it's not part of the curriculum. It's not considered a legitimate basic science. Evolutionary biology isn't. Thus, we don't really learn how to think about evolutionary explanations for why disease happens and why there's so much of it now that coincides with the effects of cultural industrialization that started about 200 years ago. But we also live longer now. We don't live better necessarily for longer, but we live longer and there's more of us. So it's sort of a two-edged, maybe three-edged sword of what's happened with industrialization. But I'm really concerned about mostly how did tooth decay and gum disease happen? And after I sort of figured that out with the input of anthropologists, because they've known about it for decades, I started applying my curiosity towards the need for an orthodontist. How come there was never a need for an orthodontist till about 250 to 300 years ago, yet anatomically modern humans have been around for almost 300,000 years? Like, what happened? That's what my curiosity stems from. And then I, based on my undergraduate, work in my 50s in anthropology, I was able to write a few abstracts with some of my professors, and it got me noticed by Dr. Mariana Evans, who's on the orthodontic faculty at Penn, University of Pennsylvania, and she was always wanting to explore the skulls at the Morton Skull Collection at the University of Pennsylvania Museum. So she invited me to give a lecture in the orthodontic department and arranged for us to both meet the curator of the museum skull collection, Janet Monge, and she invited us both to be visiting scholars, and that was 8 years ago, and we've been working there ever since.
So if I understand this correctly, here you are hanging out in Chicago, dentist, taking care of kids, and there appears to be patients that are coming to you with issues that triggered this curiosity of why is there a predominant structure in these children that are coming in that seems to be different, that's impeding health, and you trace it back to the skeletal framing members and history?
Well, it's kind of, that's on the track of it, Ed, but I remember a seminal moment in 2007 where I attended a symposium that was conducted by a epidemiologist, periodontist, gum specialist named Philippe Pujol. He's from Belgium, and he showed one slide of tooth decay of a prehistoric, person, and he said, you can look at this and know without any radiometric dating or X-rays or anything, if there's decay on more than a few teeth, that means that skull is less than 10,000 years old. Well, how do you know that? And he goes, that's when agriculture was discovered. And he was right. At first I thought, that's BS. There's no way I would have learned that in dental school if that's true. And that was before quick, fact checking on my phone. And when I got home and did, I read Weston Price and I got turned on to all kinds of things. The anthropologists have known this connection for decades. Yet I, a board certified pediatric dentist, didn't have a clue about it. And at first I was angry. And then I turned that anger into more curiosity. And now here I am. And I get to talk about it all the time to nice people like you that have great audiences that are curious. So that's kind of how it started. Tooth decay became other things.
It seems like a really deep rabbit hole, and it can go as far down as we want to take it. What are some of the steps that you're taking today to make adjustments in the structure of the face and the airway, and how is that different than how you were treating patients when you came out of medical school?
Dental school.
Dental school.
Yeah, much more prestigious than medical school, by the way.
Thank you. I'm sorry.
So, it's like Michigan or Michigan State, right? Okay, so here's what happened. I trained at the University of Iowa in the mid-'80s because they had a very prestigious and advanced program in treating orthodontics early, because it's been known for over 100 years that when you can pick up a jaw that's too narrow and there's no chin forward, retrognathia, if you see that at age 2 and perhaps even in utero, it will reliably persist into later childhood, adolescence, and if it's not corrected in early childhood, it can turn into something really nasty in terms of you might have to have teeth pulled and all that. So airway didn't even enter into the conversation. And I learned my cephalometrics and growth and development. Those are the sciences of measuring a kid's jaw growth. I learned it from Professor Samir Bashara, who is a famous orthodontist who taught the orthodontic department. Well, I'm a pediatric dentist, but they really made it part of the pediatric dental curriculum. And we were one of the few in the country at the time. And that's why I wanted to go there to take classes with the orthodontic residents. So I left with the mandate that if you're going to be treating orthodontics, you're going to do it according to American Board of Orthodontic Standards. Mm-hmm. So I always took it very seriously. But we really started treating these kids till maybe 7 or 8 years, because the American Association of Orthodontists say you shouldn't see kids till 7. Well, now 7 is a geriatric patient in my practice. All right, I'm seeing these kids at birth. Sometimes at birth, I'm looking at mid-gestational ultrasounds of fetal profiles, and I'm at least starting to address expanding their jaws by 30 months of age, 2.5. That's when they have 20 teeth. And that's in medical and dental literature all the way past 100 years ago, that physicians and dentists were working together to solve nasal respiratory issues by expanding the jaws, not to create straight teeth and cosmetics. It was unbelievable. I can show you 100 papers, and I'm publishing book chapters now, and I'm quoting that old research that needs to be paid attention to. Usually it's poo-pooed by the orthodontic profession. Oh, those aren't random controlled prospective trials. Do you know when random controlled trials started? After World War II. After World War II. How did cholera get discovered? E equals MC squared. Those weren't random controlled trials. Those were thought experiments. Those were observational studies. So that's, one foundation that that's really the foundation of the rest of what I probably will talk to you about.
When you're speaking about expanding the jaw, you're talking about taking the upper jawbone east and west and the low jaw forward?
Perfect. I like that. East and west. That's really good. Yeah, absolutely. Is that if you lick your tongue on the roof of your mouth, you'll feel a line up there. That is the mid-palatal suture. It's like the soft spots on a baby's head, the fontanelle. Mm-hmm. It's a suture that can be stretched. There's no bone there. It's all cartilage in a little kid.
Mhm.
And all the way up to, adolescence and young adulthood, you can stretch that suture. So you can help make, and why would you do that? Well, not only to make room for the teeth that aren't in yet, the permanent teeth, the position of the teeth is a proxy for how much room there is for a tongue. And if there's not room for a tongue, and again, in our pre-industrial ancestors, if a child did not have room for their tongue in the first 4 years of life, they died. They did not survive childhood. Now children can survive childhood with crooked, narrow jaws and crooked teeth and retrognathic jaws that are too far back. That was a death sentence for children. That means they weren't nursed and weaned according to an ancestral pattern. And there's reasons for that. Famine is one of them. And if a mother died in childbirth, sorry, the kid's gone because they can't nurse and wean. An ancestral pattern of nursing and weaning means on-demand breastfeeding for at least 6 to 10 months, followed by something called baby-led weaning, weaning onto firm and unprocessed wild foods that parents were eating, that the kid, if they weren't eating everything in the tribe, as hunter-gatherers for the first 250,000 years of our existence, they died and they were left under a tree. They couldn't move on with the family unless they could eat everything that everyone else was eating. There was no Gerber baby food back then. So that's one fundamental that every dentist and every pediatrician needs to understand. And it took me a long time. That rolls off my tongue as if I learned it yesterday, and I didn't. It took me a long time.
That is just amazing because, this is not the general, message that you hear coming out.
Not
When
yet.
I was a kid in 69, 70, 71, I went to the orthodontist because my parents wanted my teeth to be straight and I could have a great smile and go out and make $1 million and make everybody happy. And the orthodontist, I believe, was pulling my jaw back.
You're still doing it.
To create the straight teeth. Now, and then, like you just said, if you're 7 years old, you're geriatric to you in what you're doing now. So number one, I was like 10, 11 years old then, and they were pulling my jaw back to straighten my teeth. And now what you're saying is genius in regard to getting at the issues earlier on and creating the type of structure that you want to see through the skeletal framing members of the face.
In fact, thank you, but I didn't discover this, and neither did any of my contemporaries. I've uncovered literature. Literally, the first expansion was done by a man named Edouard Augustus Bogue, B-O-G-U-E, M.D.D.D.S., practiced in London, Paris, Chicago, New York, and Boston, and limited his practice to kids under the age of 6 and expanded the deciduous arch, he called it, not to create irregularity, to fix irregularities of the teeth, but to improve nasal respiratory competence in children such that they would not suffer recurrent apnea after adenoidectomies, and to actually prevent a lot of tonsillectomies and adenoidectomies by just expanding the deciduous arch. And I will share all these references. I published on this, but it's a rediscovered protocol. Physicians and dentists worked together incessantly prior to World War II. When all the white men, who were all the physicians and dentists, went off to war, came back, and coincidentally, it was all forgotten, and it was seen as more profitable to just invent more orthodontic appliances that you could put on permanent teeth and to take out tonsils and adenoids. But you didn't necessarily need to cooperate. So that isn't my hypothesis. That comes from a very prominent ENT, otolaryngologist, I believe in Connecticut, whose name I won't mention until I get permission, because he expressed that opinion to me. What the hell happened? And he said, here's what I think, follow the money. And he's published a beautiful article. You know what? I'm going to tell you who he is. Harold Stupak, Howard Stupak, S-T-U-P-A-K. And just hit his name with gravitational forces. And you can read his hypothesis that is predicated on Christian Guilleminault, pediatric pediatrician, and I think he's a pulmonologist at Stanford, 1976, who discovered that children can get apnea. And that is like, oh, you mean dogs can get diabetes? I mean, a mammal can get anything another mammal can get. And sleep apnea is just because adults got it. But in 76, he published a seminal paper that children can absolutely get sleep apnea. And Karen Bonnick at NYU, Albert Einstein in the Bronx, discovered that if a kid snores prior to the age of 3 or 4 years old, they're going to be at huge risk for ADD, ADHD. Go figure. And then the connection between the shape of the jaw and snoring. Oh my gosh, make the connection. So anyway, sorry, I'll talk. Do people have questions? Are you going to monitor this, Ed? Or?
Yeah. I have a question now from Evelyn Wangs, and she heard what you just said and said, I wonder if that's why my son snored his entire life and now he uses a crap machine and he's 54 years old.
She means CPAP. That's a Freudian slip. Evelyn, I love it. I'm going to use it. It's a CPAP machine, but I like the R instead of the P for it follows AP. It's a crap machine. I love it. Yes, probably. And really what I do is I like to empower female caregivers who bring their kids to me, because when I often will start to, tell them what I see and think out loud, I hear, I thought so. And I was made to feel foolish by my kid's pediatrician. And you know what? The most powerful instinct on planet Earth is maternal instinct. They got something we don't have. Our Y chromosome gets in the way. That when a mother feels there's something wrong, we better listen. And I didn't do this my whole career. It really happened about 10 years ago when one woman in my practice said, you know what, Kev, you're a great dentist and all my friends come to you, but you suck at listening to me. And you need to manage my expectations better. And she scared the hell out of me. She's like 4'10". So anyway, listen to moms. That's what I advise all my pediatric healthcare colleagues.
I think that's sound science there, my friend.
I was jumping back on because I was listening to some of this, and I wanted to show you, based on some of what you were talking about, this might look familiar to you. This is me, right?
I think I've seen these.
I emailed these to you.
Oh my God! Yeah,
right?
I know. Yeah. You.
Because guess what they did?
They probably maybe took out your tonsils, then they pulled your teeth and they put you in headgear.
So I had 8 teeth pulled. I had braces put on.
Yeah.
And then I had the procedure where they cut your jaw, slide it back, and had my mouth wired shut for 8 weeks. I was in 9th grade.
Wow. Mandibular setback, it's called. And, hopefully in my lifetime, that will become malpractice. What we do now is the opposite. We advance your upper jaw and leave your lower jaw alone, or actually advance both your jaws, even though they told you your lower jaw was too far forward, and MMA, it's called, and Resimo overhead, Larry Wolford in Dallas. They're the two most famous people we refer everybody to. So.
I wanted to jump back in and show people that because if there's parents out there that are still hearing they need to do this for their kids, they need to get in touch with you. They need to do more education, because while most of my life I was fine, I'm now 55, and you can probably see it. Maybe the average person can't, but my upper jaw is collapsing in. My jaw here, I'm having some issues on this side, and it's creating some headaches and stuff with my occiput. So, this stuff is coming back now later, and thank God I have a breathing background because of my husband, but God knows what other things could be going on. So I've got to deal with some things now.
The other thing, not only, and that was, they did their best, it just, but in maxillomandibular advancement surgery, I do that for 2, 3, 4, and 5-year-olds, but it's non-surgical. It's called distraction. And distraction is just when you stretch bones. And then little kids, I just say please to the bones, and they just do what I want. It's like, it's really amazing. And the other thing is compliance. Well, orthodontists, we don't learn about how to manage anxiety in kids because it's implied we're not going to see them until they're 12. So why should we have to learn that? So I say, don't blame your orthodontist. It's their curriculum. Yeah. That's what's got to change. And the other thing is that I've learned from the cultural anthropology aspect of my training is that children are hardwired, the wild type of behavior is to not only be obstinate, okay, but to be obedient to the adult caregivers, the elders of the tribe. They want to please. So if a parent sees early dental facial orthopedic distraction intervention is what I do, gentle expansion, advancement, myofunctional therapy, eating hard foods, nursing and weaning like our ancestors. Those are all non-invasive interventions. And if a parent, especially a mom, sorry dads, that if you guys see this as a component of comprehensive wellness, caring parenting, the kid is going to do it. They're going to wear the pandemic mask. They'll wear the glasses. They'll wear the expanders because they want to please you. So I really, if a kid won't open their mouth, the first thing I say to that child is, you know what, honey, you don't have to do anything you don't want to do at Dr. Kev's office. I'm going to leave the room, and mom and dad are going to take another day off of work in a few weeks, and they're going to bring you back. And usually when I come back, the kid is wide open. And I don't care that kid's been bribed to go to Disney or, whatever. More often than not, that kid can't wait to open his mouth. And it's just a little trick I learned as a pediatric dentist 30 years ago on how to get a kid to open up for their first dental exam.
Yeah.
Mm-hmm.
And it works. Orthodontists don't learn this, but we're teaching them. And we're teaching dentists and, general dentists, family dentists, orthodontists, pediatric dentists all over the country. So, you know what? Put pressure on pediatric dentists and pediatricians that, you got to start paying attention to my kid's breathing. And the dentists, look for more than cavities. Look for sleep and breathing problems. And the ADA is fully supportive of it. So glad you brought that up. That is a great testimonial of what happened to you, what they did to you, not for you.
Right.
Shame on them. But it's not their fault. It's their curriculum. Get mad at their curriculum.
I know. And parents, my mother thought she was doing the right thing, right? She thought they were saying I was going to have health issues down the road if she didn't do this. So she thought she was doing the right thing. So between parents, there's no point in having guilt. It's the awareness we had at the time. It's the level of consciousness we had at the time.
Yeah, sometime I will tell parents, because they'll say, oh, my parents couldn't afford orthodontics. Well, if they're still alive or if they're not, drop something on their grave, but call them and thank them for not being able to afford orthodontics.
Yeah. Right?
You die with straight teeth and you die, forget it. Yeah. You want to have the straightest teeth in the graveyard? Be my guest, Sorry, oh my God, I'm going to get in trouble for that if there's orthodontists here.
That's all right. We're here to ruffle some feathers in a loving way.
Yeah. Not comfort the afflicted, but to afflict the comfortable. That's one thing I have.
There you go. There's growth.
Yeah.
What are we finding in regard to the structure of the face, the structure of the teeth, and how is this all tied into the brain?
Well, it has to do with oxygenation. It really is oxygen utilization. When you get on an airplane, mom or dad, and you got a baby next to you, what does the flight attendant tell you to do? Put it on the kid first, right? Of course not. Put it on yourself first.
Yeah.
So you can help that kid. Well, for all nutrient substrates, including oxygen, when I got my master's in nutrition and dietetics, I learned that H2O and O2 are nutrients, not just vitamins, minerals, and trace elements and phytochemicals, but it's a respiratory substrate. Oxygen is. It's the only substrate that the mother has priority for. Baby gets the most water. And if you read about something called the Barker hypothesis and prenatal programming during the hunger winter of 1944 at the end of World War II, that the Nazis starved out the Dutch resistance because they were so savage at wiping out Nazism and ending the war. So the thing is, they found that women who were starved because of the blockade of the Nazis, who needed the ports to fuel their U-boats and everything, is that the kids that were born 40 and 50 years later, after that survived, the famine and were born and grew to adulthood, 100% of them became obese, had cardiovascular disease, had schizophrenia, all these things. How come? Because in utero, according to Dr. Barker, he speculated that child, because humans over 300,000 years had learned to adjust their metabolism in utero to anticipate the environment that they would be born and live into, because kids usually died before the age of 10. Everybody did. I mean, the average age was 40, but that's infant mortality to the 560-year-olds that live. So it is that they were anticipating that there would be a 10-year famine. So you had to be stingy. It was called the thrifty phenotype, is that you had to be stingy with calories and grab on and hold on to them. Well, these kids that were born in the Netherlands after the Dutch famine, the Canadian Royal Air Force dropped in lard and butter and all these starches and fats, and these kids ate like crazy. Well, over time, it led to something called metabolic syndrome and all the disease that followed. Well, now we know that. Well, oxygen, if women don't breathe right during pregnancy, there's something called gestational apnea, and your audience will be the first to probably know about this. If a woman doesn't breathe right, and this is a hypothesis we're testing at various graduate programs in orthodontics throughout the country, their jaws will be small, not just they're small for gestational age, and preterm birth are two consequences of a woman who might have sleep apnea during pregnancy. In addition to folic acid, that's important, nutrition, in addition to yoga and having healthy activity, sleep and breathing in pregnancy can impact that child. And that child, if a mom isn't breathing right, that kid might think they're being born on top of the Andes Mountains where the air is thin. So you ever seen mountain people? They're tiny and they'll be born small. That is an experiment that was inadvertently done. That people born on mountains are smaller than people, that same mom, if she gives birth at altitude, at sea level, that kid's going to be bigger. Who knew that? Who would put that together? And it wasn't me. I some dentists who were criticized for over speculating, and aren't alive now. They're the ones who came up with that. I just developed it a little bit. But interesting connections that just need to be made, and these platforms like what you have, Ed and Wendy, this is going to help this. I always get emails from people after these forums, and I learn so much from your audience. I'm going to learn from people. Hopefully they'll get something from me too.
In the research that you were just talking about, is there, when you're talking about pregnant women, because
yes,
they're also having a lot more progesterone in the body, which is a respiratory stimulant. So are you looking at that too and how that plays into it, or any consideration?
I will now, Wendy. I will now. No, I rest my case. I mean, this is something, you know what? And if you Google it, you can probably find something in I don't care if it's scientific or not, because I can dig into the science. I have access to the most comprehensive scientific database in the world by virtue of being a visiting scholar at Penn. I can look up anything from any time. So please, where you came up with that, you just connected something, and I'd like to help you pursue it. That's really amazing. Thank you for that.
Yeah, because there's several times for women when progesterone levels are higher. So even menopause, I often look at, like, now I'm dealing with that too. So I look at that, and so women's breath rates increase because of the progesterone. So, and then I think, well, how's that feeding into women with heart disease? So I think, there's a hormonal component to look at this with what's going on at the body at different stages too. So interesting.
Yeah, I was not totally unaware of that. Just the fact that I'm asking parents, I'd like to see an ultrasound. What? And then as soon as I show them some things, and the way that we got this committee at one of the out east orthodontic residencies in the city of Boston was showing in my own practice of kids who's needed this non-surgical distraction, widening and advancement, and what they look like on an ultrasound. It's just, it's a very small sample size. It's not scientific yet, and it may never be, but it's a hypothesis worth exploring. And even what you just, offered by the progesterone possible link, that could figure into what we're going to look at later on. So I really appreciate that.
Wow, you are simply an amazing
Cool
wealth
stuff.
of knowledge. Is there a theme to the patients that you're seeing today, and there is a practical application to what you're seeing walk through your office doors on a regular basis, Kev?
Well, it really, I don't get many what I call free range or garden variety pediatric patients. I mean, somebody who just moved to the neighborhood and saw my sign, or they went to their pediatrician and they got a list and I'm on the list, or one of their neighbors, go to him. I would say it's probably less than 10% of new patients that are coming to me are because it's just random. They want their kids' gums and jaws and rule out tooth decay and gum disease, and which is important, okay? And that's really the bulk of what I did for the first 15, 20 years of my career. It just, most people know about me. And, I asked the other day, my office manager, because I'd gone on vacation, and then I just got back from UCLA, where I spent 3 quality days with our mutual friend, James Nestor. He actually attended the meeting as a registrant because we'd never met in person. Mm-hmm. And he saw the people on David Gozal, who you may or may not have heard of, but he's a pediatric sleep medicine physician who was invited, to speak at, that was Kentucky, but the week after was UCLA. And there's mostly anthropologists and physicians that were at that meeting. And James wanted to rub shoulders with those people because, he and I both are really into the anthropological aspect of all this stuff. Yeah. And we've talked, and he's invited me to venues. Apparently the BBC is going to be airing a podcast that he invited me to recently. But we'd never met in person. Mm-hmm. So we had 3 wonderful lunch sessions together. And I don't know, my staff told me, we just put referral source, James Nestor. And it's surprising how many people come just by him having mentioned me a few times in his book. Yeah. And the other thing is more myofunctional therapists. A lot of people I didn't know this specialty existed. And it's mostly dental hygienists, speech pathologists, and physical therapists, and some dentists actually, that learn about this and help kids put their lips and tongues in the right place while I'm building a house for the tongue to live in. And I can't live without them. So that's where a lot of referrals come from. I'm going to make some suggestions. Steve Carstensen is in Seattle. He's a brilliant general dentist, doesn't treat kids, but knows more about pediatric airway wellness than most pediatric specialists in any healthcare profession, and organized the whole pediatric airway wellness symposium at the American Dental Association. And Lauren Ballinger is a pediatric dentist in Massachusetts who's on the task force, with me on the faculty at the ADA. And we have a consortium we set up at the beginning of the pandemic that we call the Endeavor, named after the but Captain James Cook, the first scientific vessel, the HMS Endeavor in the 18th century. And so it's all pediatric dentist, orthodontists, general dentists, and myofunctional therapists. Nestor actually has lectured to us, but you may want to get some of the Endeavor members, and certainly if you've not had Nestor on, you probably have.
Yeah.
And also Steve Carstensen, who's part of the endeavor as well. You want to get some of these people on. They're all visionaries, and they would love to be part of this, I'm sure.
Awesome.
So we've got this breathing thing that takes place 20,000 times a day, comes in and out through the nose. It happens on its own if we don't want to control it. And then we've got the skeletal structure of the skull and the face, and we have this oxygen distribution, and we have the structures around the brain. How can we harness the science that's coming up today in the most productive way to leave some really good seeds behind us for the next generation to grow this awareness?
Well, one of the ways you can grow the awareness, and obviously you're not afraid to inadvertently piss somebody off. Yeah, well, if it's for a good reason.
Yeah.
And that I had a lady yesterday, and I have her baby, 3.5, 4-year-old, and yeah, this kid really, wow, this is the poster child. I mean, the jaw's narrow, the palate is high, there's lip tie, there's tongue tie. The kid wets the bed, the kid snores, the kid sweats. They can't wake herself up in the morning. They want to put her on ADD meds. And so, this is great. I'm just, she's read about me. She knows we when I do the consultation, I show the before and afters. I've got a huge list of parents that say, look, if a parent comes in here doubting what, the veracity of what you're doing, please have them call me, because you made believers out of us just by, helping our kid, and we're grateful. And I said, to this, about the treatment, and she goes to the front desk, and then she says, oh, Dr. Boyd, would you please write a note so that I can tell the school board that she has respiratory issues and shouldn't wear a mask? And I said, unequivocally, I will not do that. And in fact, she's supposed to have her mask on now. Now, a lot of people don't know it. A dental office is the safest place to be in the world during a pandemic because of, well, it is because of AIDS and hepatitis B in the 70s and 80s. The mandate from the CDC for dental offices, we have the best infection control in the world than anybody. And we're on steroids now with it. So, but I said, no. In fact, you know what? I have additional motivation, and you should too, to get your child to become a habitual nose breather, because nitric oxide is the most powerful antimicrobial that you can get from Mother Nature, and it resides in your own paranasal sinus complex. When you inspire, you create turbulence, the turbinates, which causes L-arginine, an amino acid, to turn into pre-nitric oxide synthase, which synthesizes nitric oxide, which opens up alveoli in the lungs, facilitates oxygen crossing into the alveoli to get into the lymphatic portal system to the brain. It kills bacteria, fungus, coronavirus. I don't know if it works against the variant, but why take a chance? Inhale and exhale through the nose. You know this. Warmth and humidification of the air. It doesn't happen through orally inspired junk food air. Nasally inspired air is health food air. And that's what you can do for your child. I'm not writing a letter. If I lose you as a patient, I will help transfer your child seamlessly to somebody who is in LA. Bill Hang, you're going to have to travel to LA to guarantee you're going to get what I can give, or Boston, where Lauren Ballinger is, and a couple others. But you know what? They never leave me. Point well taken. Hopefully she'll start wearing a mask. So you can impact people that way by just getting under their skin a little bit in a good way.
Yeah.
This is how I can help you and your child. Wear a mask. I also got a ad from a newspaper in 1919 that says wear a mask, and all the lists why men won't wear masks because it's too feminine. Women don't need convincing. I'll send it to you. It's a great slide. So nothing new under the sun.
Can you explain a little bit of the bullet points that we need to be aware of in regard to what is the physiological and psychological differences between nostril breathing and mouth breathing? And why do we need to be in this nasal dominance throughout our life?
Well, warmth, humidification, nitric oxide, and mechanical filtration. I mean, there's just all these things that don't happen. You're probably into yoga or meditation. I mean, you know what ujjayi breathing is. Well,
Right.
they never talk. What yoga instructor talks about nitric oxide? They should. If
Mhm.
you've not had Patrick McEwen on yet and talking about utero breathing, he will tell. He knows about ujjayi breathing. And so just the actual what you did at the beginning, that was beautiful, to get people to relax, to calm down, breathe through your nose. And I don't know what else to tell you. And also growth hormone. I really try to shame little kids into, going through with this treatment and wearing a reverse pull face mask to help the jaw come forward. Hey,
Mhm.
dude, you want to be 4'10" the rest of your life? Growth hormone surges when you're breathing through your nose while you're sleeping. I mean, sleep, breathing, and living in the northern hemisphere between May and October, growth hormone surges in adults and kids. That's why kids never look the same from when they get out in the spring and go back in the fall. They're all taller. And you can play into the kid. You want to perform better in your sport?
Mhm.
You got to be a nose breather. So there's all kinds of things you can do. I would say growth hormone and nitric oxide are the things that you can really get people's attention. Um,
Mhm.
the person who discovered nitric oxide as being a vasodilator is responsible for why you take nitroglycerin for angina. Won a Nobel
Mhm.
Prize for it. It's the same mechanism.
That is amazing. I got a question for you, Kev. Which reverse headgear do you recommend?
I really don't talk about protocols, and that we teach. We have a, if you're a dentist or a myofunctional therapist, you can sign up. I'm not trying to drum up business here because we're setting learning centers, learning networks all over the country. But if somebody asks me what expander do you use, what I use reverse traction for a reason. I want you to think about the problem. Obviously, whoever asks that question understands it's a problem. You don't need an underbite to need reverse pull headgear or one that is obvious. It's almost a blessing. When you see a kid with an underbite, Jay Leno had a borderline underbite at 4 years old. Somebody could have fixed that. Somebody could have prevented that, but he probably wouldn't be famous now. So, but it really is. You don't. So whoever that question is asked that question is very astute, but it depends on the kid, and it's not just that. If the kid has vertical long face tendency, you must suppress that vertical growth development before you introduce any type of reverse pull headgear. So it's a thought process. And so I don't do that because then again, people will start doing it. And then, oh my God, I put him in a headgear and his long face got worse. Boyd's a quack. No, you must learn how to think about this. And I'd be guilty.
Yeah.
Just not going to do that. And I'm sorry. This could be somebody who asked that already knows all that stuff, but I don't know that. And if you want to email my office, it's dentistry, the number 4 children dot, no, dentistry for children.gmail.net. You can put it up, or kbo569@gmail.com is my personal email. Google me, and I'll give you all the info you need. And if you can't join our course, we will tell you someone else in your community who's either already doing this or already took our course, and I'll help anybody get this going locally.
Awesome.
Well, it seems to me that everything seems to run off of what's going on right here. And this seems to be news to people. What's up with that?
Well, again, going back 100 years, in the Journal of the American Medical Association and the Boston Journal of Surgery and Medicine, which is now called NEJM, they talk about something called the outer face and the inner face.
Mm-hmm.
We've been two-faced for all of our existence, okay? And what I say is the front of the airway is the external face. What you see is what you get. The back of the face is the airway. And again, I have scientific literature that backs this up. And if you want the face to be the most beautiful, attractive face that you can get, it must be one that projects to the eye of the beholder subconsciously that that person breathes through their nose. And that's called Darwinian sexual selection. It's attractive. You know, the full cheekbones, the full upper lip, the strong lower jaw. Those are people that tend to be habitual nose breathers and that will carry children well. It's called Darwinian sexual selection or evolutionary fitness. They will survive childhood, thrive long enough to age of reproduction, and live long enough beyond to get their offspring into the next generation. You must create this, and it used to mean that's the only way you're going to get out of childhood. You may not make it to age of reproduction. You might not make it to 10. Most people didn't. Read another thing your audience should know about. It's called the health span, not lifespan, health span, all one word, HEALTHSPAN, the health span imperative. And watch the 10-minute video narrated by none other than, oh my God, Martha Stewart. It is wonderful, scientifically accurate. And there's also from Jay Olshansky, who I believe is an epidemiologist at the University of Illinois locally, who is very interested, at least he says he is, but can't do anything to 2022, but stay tuned, to work with me to increase children's health spans and lifespans by optimizing airway structure and function at the earliest possible age, preferably before the age of 6. So watch that. It's a great video. The health span imperative. It's an amazing movement that's going on in healthcare right now. That's increasing the amount of life expectancy from birth, and increasing the amount of time that child will stay healthy into old age and hopefully die quickly at 106. Okay? And every kid now, even with the pandemic correction, will live to be over 100. Kids who were born from 2015 forward are projected to live over 100 years old.
Wow.
Wow.
See what happens if we're still here as a species.
It's how we live. It's great that we're living longer, but yeah.
It's how we live in early childhood.
Right.
And sleep apnea uncorrected in early childhood just came out. American Heart Association. They will be very susceptible to hypertension and other cardiovascular defects, problems that will persist into adolescence and adulthood. I'll send any literature that I'm quoting here, but it's there. Google it.
Yeah, one of the things, I'll just boast for Eddie for a second, one of the initiatives that's going on with us, and so you can even share this, Kev, with your audience.
Yeah. Is
Eddie has created a whole breathwork platform on Goldie Hawn's Mind Up, for Goldie Hawn's Mind Up organization, and it's dedicated to teachers and parents so that they can start to learn to breathe better, and then also teach their children to learn to breathe better. So that actually gets launched on September 7th.
I'd like to join that club. That sounds amazing, really. Yeah. I mean, anything I can do, let me know. Not that I need more to do, but I'm picking and choosing things, and I'm trying to practice less. It's kind of hard getting out of practice when Nestor's got my schedule building. So, but it's a good problem to have. I'm hiring more people, getting more space. Yeah, it's great. Great place we're in right now.
It is.
Well, Kev, I really appreciate you taking an hour out of your life to share this unbelievable rich knowledge with our audience. And gosh, you are just an American treasure. And I am so lucky to be alive.
Thank you.
When the time you were alive. This is powerful. And you really are making profound changes and shifts in awarenesses that are going to last generational. And it's going to make just a much more better species. So I really appreciate you, the work that you've done. And I wish you nothing but every success moving forward.
Thanks, Ed and Wendy. A real honor to be with you guys. And please, Wendy, keep me in mind as you move forward with the launching of your new platform. It's excellent. Okay, you guys, got to go to another one now.
Everyone.
But have a great weekend.
Thank you.
And, see you. So, where are you guys located again?
Utah.
We're in Utah.
Whereabouts?
About a half hour outside Salt Lake City, in a mountain.
Oh my God.
Yeah.
Hey, boy, I'd love to come out. I go skiing there sometimes with my daughter who's in Denver. So maybe we can meet sometime.
Oh,
Or
for
you stay,
sure.
just stay with
Please.
us.
Yeah,
It's all
You know
good.
what? We might take you up on it.
please
Plenty
do.
of room.
All right. Likewise, if you're in Chicago, let's go to dinner.
Thank you.
I appreciate
Okay,
you.
guys.
Thank you.
See
Thanks,
you later.
Kev.
Bye-bye.
Bye.
Bye-bye.